Uganda registered the highest COVID-19 cases since 21st of March 2020. Out of these, 52 are Ugandan truck drivers, while 32 are contacts, the Ministry of Health says, have been under quarantine. The sharp increase starts from 23rd March and has authorities worried.
It worries everybody, and I believe that's why you are here. It worries all Ugandans. If there is any Ugandan who is not worried, then there is a problem. Having 84 cases once, after deducting 51 from other countries, really worries us as a ministry. One, it worries us in a sense that we fear that our health services can be overstretched. Secondly, we fear that when the number starts going up, management of our health, of our patients can be challenging. The supplies, medical supplies can be overstretched. And like that, we can now start losing people, which we don't want.
According to the coronavirus tracker, which keeps track of all cases registered around the world, Uganda's curve is on an upward trajectory. On 30th March, Uganda had 33 infections, which shot to 54 on 13th April. From 13th April, the cases increased to 79 on 27th, 2 weeks after. From 27th April, the cases shot again from 79 to 121 on 11th May. From 11th May to 25th May, the cases went up to 222 cases. The cases have increased a record high of 417. According to Dr. Obuku, this was expected.
We know that the cases are increasing exponentially as expected anyway of COVID-19, like any other flu. It spreads very fast like any other viral flu. And this is not unique to Uganda. It's the same to over 10 African countries which have registered the over 50% increase in a very short time. There is even that week where we registered over 160% increase when we discovered it a lot in truck drivers. The bulk of those who have been detected, I understand, are truck drivers, so we know where the problem is. And therefore, it should be no cause of alarm because we can target the interventions.
Most of the cases registered so far come from truck drivers who, because of the crucial role they play, remain a challenge in the fight against new infections. Besides Busia border in Mutukula, drivers coming through a Legu border post between Uganda and South Sudan have in the recent past dominated the new case numbers.
We want, first of all, they are still under lockdown since they are border district. Then secondly, we want to go back and do mass testing.
We target the truck drivers where the problem is, give them education, give them information, give them incentives, but also give them masks to those who are at risk. Those who are going to quarantine, they need to be taken care of. We have seen pictures coming from quarantine centers where, frankly speaking, it's like a prison.
There have been reports that some of the truck drivers are allegedly forced to carry passengers while inside South Sudan, exposing the drivers.
We have minimal control over our partner sister country, but the heads of states are in talks currently. There are talks between our president and Salva Kiir of South Sudan. We want to see how best we can solve this problem once and for all.
Cabinet is yet to sit tomorrow to forge a way forward ahead of the President's nation address tomorrow. There is a high likelihood that the cases could even increase because the contacts of the truck drivers also have other contacts. And therefore, since it is very hard for government to control how people interact with others, the best remedy that remains now is to ensure that everybody adheres to the ministry's guidelines, especially preventive ones, which include keeping social distance, washing your hands regularly, and ensuring that you wear a mask whenever you're in public. Sudhir Yarhanga, NTV.